So now we're going to transition to a live recording of the Docs with Disabilities podcast. So let's go ahead and bring in our 4 interviewees. We have Emmanuel Asenso, Joe Simona, Satendra Singh, and Allison Kessler. So if you all could join me, I'm very excited for this right now. I've been reading your transcripts and listening to your interviews again. And actually, I didn't get to interview any of you the first time. You were all interviewed by Lisa Meeks. So I'm glad that I get a chance to also chat with you. I don't know if you guys know this, but the 4 of you were specifically chosen to be on this episode because you have the most listened to episodes out of everyone on the podcast. So you guys are our like top 4. So what I'm going to do right now is I'm going to let you all introduce yourself, take about 2 minutes each, and then we'll get into the questions. So I'm going to start with Emmanuel Asenso. Dr. J, please.
Yes, sir. Yes, sir. Yeah, like I am Emmanuel. It's Essential Junior, but my nickname is J or Dr. J. I am a second-year resident right now in the combined family medicine and preventive medicine residency at Johns Hopkins and at Methodist Franklin Square. And I am a person that has a childhood onset fluency disorder, like also known as a stutter. And I'm very like honored to like be here and like be a part of this recording. Oh, and I am a Black male, and I'm wearing a gray turtleneck, and I have a full beard, I guess, is part of my yeah. Thank you.
You're a second-year resident now. That's amazing. Yeah, you were a medical student when Lisa interviewed you for the podcast.
Yeah, time on flies.
All right. Well, how's it going? Just give us a little more background on how your residency's going so far.
Yeah, I mean, it's definitely been a blessing. I mean, I think I've been learning so much about how the healthcare system works. You know, I'm also a primary care doctor here in Baltimore, Maryland, and I've met so many great patients and being able to kind of help them throughout their journeys and trying to like achieve better health. So it's definitely been I'm living out my dream, also living out my nightmares too, because there are definitely things that as a child that I never thought that I could endure or go through, but I'm living through it every single day. So it's definitely been a blessing.
Oh, that's amazing. And we need you here. We need you so much. So that makes me really happy. All right, Dr. Joe Simona.
Hello, my name is Dr. Joe Stamona. I'm performing deaf in both ears. So I went to University of Michigan Dartmouth. Then finished, I went to University of Texas San Antonio for my residency. So I grew up I didn't learn sign language until later in high school. And now I'm just doing advocate for my deaf and hard of hearing community to allow for equal access to the dental field.
Now, you were also a dental student when you were interviewed, and are you still in residency or are you in practice now?
Yeah, I just finished. I've been practicing in a private practice for a year, and when I was interview, I think I was a 30-year dental student. Yeah.
All right. Well, congratulations to you also. Fantastic. All right. Up next, Dr. Satendra Singh, coming from us, I understand, very late in the evening from India.
Yeah, hello everyone. Namaste from India. It's good evening, everyone. It's 9 p.m. in India right now at New Delhi. So my name is Satendra Singh. My pronouns are he and him. I'm wearing light blue shirt, and behind me is a light green wall. On the left side are my crutches, and on the right side there is a lab. And I am Director Professor of Zoology at University College of Medical Sciences, University of Delhi. I'm also the co-chair along with Dr. Lisa Meeks at the International Council for Disability Inclusion and Medical Education. And I'm also a member of the National Human Rights Commission on Disability in India. Thank you for having me.
Thank you for joining. Appreciate it. Okay, and last but not least, Allison Kessler. Dr. Kessler, please.
Hi guys, I'm Allison Kessler. I'm a light-skinned woman. I have dark hair, hazel eyes, a green shirt, and books behind me. And hopefully you will not see my cat who keeps trying to get into the screen. But if you do, it is a dark black Persian cat. I am a spinal cord injury physician. I am certified in physical medicine and rehabilitation and spinal cord injury medicine. And I'm the section chief of spinal cord injury at the Shirley Ryan Ability Lab. And I myself had a spinal cord injury, so you can't see it, but I am a manual wheelchair user.
Yeah, and I had the pleasure of meeting you in person last weekend at the AIM Access in Medicine Summit in Chicago, Illinois. Thank you for giving me a tour of the formerly known as Rehab Institute of Chicago. Oh, we were touring around and I was like, Shirley Bryan Ability Lab. Huh. I've never heard of this. And then you said it used to be the RIC, and then all the light bulbs went off. There was really just an awesome moment when a patient, a newly injured, I believe, patient came out of the ward, one of your patients, in his wheelchair, and you were there in your wheelchair, and you guys had this great interaction. And it just was a great, just a great moment. I would imagine that is just really heartening for your patients to see their doctor with a spinal cord injury treating them.
I hope so. That's, I think for me, I like to try to lead by example when I can. And what's powerful about the wheelchair is that I don't have to say anything. I can just come into the room and be their doctor. But I do have people tell me, throughout their stay or when they come back and see me that seeing me working every day and being there reminded them that their life wasn't over because something happened to them, and that they too could still pursue their dreams. And that is really rewarding, as I'm sure many people on this call, working in healthcare is hard. And there's a lot of work every day that we all do. And so having something that enriches the soul and makes you feel like the work that you do is important keeps us going, because sometimes it's hard. And so when I hear that, it just reminds me that I have to keep doing it.
But it reminds me of a moment during my own rehab when Dr. Doug Oda, who directed the directs still the spinal cord injury unit at the VA in Palo Alto, came to visit me. And that also gave me hope that my life wasn't over. And a theme throughout all of your interviews was mentorship and examples. So none of us have gotten here alone. That's the beauty of our community. All right, so I'm going to ask you guys some questions. So I'm going to start with Dr. J. And this question is about the impact of sharing your journey. So how has sharing your personal and professional journey on the Docs with Disabilities podcast impacted your view on the power of storytelling in healthcare? And do you believe that sharing stories can influence policy changes or attitudes towards healthcare professionals with disabilities?
Yeah, that is like a great question. I think my personal experience with it comes from also back in the day when, as a person with the childhood onset fluid disorder, it is quote unquote a invisible like disability where when I was like growing up, it was my choice to like never really show that I did stutter, or like do everything that I could at all costs to not assume the fact that I had a disability or a fluency disorder. And by doing so, like I had a lot of like ableist thoughts, like where I thought that like being a person that had a stutter, that was inherently a bad thing, and that I had to whether cure it or just stop doing it forever to be able to be a productive member of society, or just to like be accepted. So I think I had that was kind of where I came from, and it wasn't until I really started doing some speech therapy during college when I really felt like I couldn't control it anymore, and I couldn't reach my goals. Like I needed to do something different. I was lucky to like find a speech therapist that was doing avoidance reduction therapy, and they kind of started my journey in just being more open about my stutter and assuming that identity and accepting the fact that that I had these ableist thoughts about stuttering and that inherently there's nothing wrong with being a person who stutters, and I can still be a good communicator. I can still be a productive member of society without me, quote unquote, overcoming my stutter or with curing it or without hiding it at all costs. So I think that really started my journey of being open and vulnerable and more transparent with who I am and with my stutter. And that started first, with just like being open with my close friends and family. And this was like in college, so like I was about 21 or 22 to 2 years old, and I started like finally talking like more about it, like sharing my story, and that kind of transformed to like disclosing it more to strangers as well, and just like being more open about it overall. So then that kind of helped me to like start doing more, whether podcasting or just like sharing it with the different people that stuttered or like have like other the different types of impairment. And I really saw how powerful that was, that by me sharing my story, by me being open and honest and vulnerable about what I'm going through, one, it was therapeutic for me, and also it kind of helped to help other people recognize that, oh, they're also not alone, because sometimes like my story will resonate with them, even if the disability wasn't the same as mine. Like there was still some common shared experiences that we all held. Like through my podcast, there is a guy that I was able to like meet and then like become very very close to. He's actually visually impaired, and through my story and just like sharing how the intersectionality between being a Black male and having the disability, like how that was affecting my journey and how I had to navigate that. That also like really resonated with him, despite the fact that our journeys were like a bit different. So I think it really opened a lot more doors for me than I ever thought it could, and it didn't close the doors that I thought it would. So I think that overall, like the storytelling aspect has been powerful in opening so many more doors for not only myself but for also others, and it hasn't closed any doors as well. And even as a healthcare professional, I'm realizing how strong our voices are and how needed our voices are. So when it comes to advocating for policy changes and things like that, our voices hold weight, and I think it's imperative that we do share these stories as well.
I found that just extremely interesting in your podcast when you talked about this idea of being able to start your journey without first overcoming your disability. These overcoming narratives are very harmful, I think, in medicine. And I think it was just a great reminder, like, you can start on your journey now. Don't wait to be cured or to overcome. Just live your life.
Yeah.
You don't have to wait. Allison, did you have anything to add?
Yeah, when I first started medical school, I had never heard of the word ableism. I don't think there was as much discourse around this. And I remember really just trying to hide my disability, fly under the radar, and try to get through, right? I didn't want to draw attention to it. I didn't want to share my story. And the first time that anybody asked me to share my story was when Lisa Meeks, I was a resident, asked me to do it anonymously. And I thought, okay, anonymous, I can do anonymous. And so I spoke with her, and that was the first time I had ever shared some of the barriers, because up until then, I think I really thought the problem was me. I had to hide the disability to be a good doctor, or I had to be better than, and prove myself in some way. And it was in speaking with her for that first time when I was a resident was where I had to conceptualize and really put into words what my experience was. And through sharing that story, I realized I'm not the problem. And why do I feel the need to want to be anonymous? And that really started me to then say, no, I need to learn more about um, healthcare and ableism and the research that's being done and what we need to do. And sharing my story first anonymously got me into thinking I need to be more thoughtful and understanding. And maybe I can help. This goes back to the mentor part. Maybe I can help somebody else never feel like they have to hide who they are or their disability. And through that is when I decided to share my story more broadly with the Docs with Disability podcast. And I think through that and other people have mentioned, connectivity and opening doors through sharing your story. And through sharing my story, I've had so many people reach out to me. And now I have this amazing community that I had felt so isolated from before, but through sharing my story, I'm now connected to. And being a part of that community has galvanized me to even more want to shout from the rooftops that things need to change. And what I realized is, and we talked about this at the AIM Summit this weekend, numbers do nothing without the stories. They don't change hearts and they don't spur people to action. We need the numbers. Don't get me wrong. Data is so essential and research has to be there to back it up. But we also need people who are willing to share their stories and open up people's hearts and minds to realize that a difference needs to be made. And so that's why I am now more willing and not afraid to share my story, not anonymously.
Thanks, Allison, and thanks for your leadership in this space. All right, my next question is for Dr. Simona. So in becoming more visible and vocal about your experiences as a healthcare professional with a disability through the podcast, what kind of advocacy opportunities do you foresee opening up for you or others in the community? And how can visibility advance the cause of inclusion and accessibility?
Before I want to get started, I want to describe myself. I'm a light-skinned male with the black hair, with a light beard, and a black shirt. To answer your question, being there are not many deaf dentists over the nation, and being one of those deaf dentists is my responsibility to be an advocate for my community. And deafness is a hidden disability. So I'm usually a shy person growing up. Then I realized that when I was more and more vocal about my experience, I start to inspire other people by being in a podcast or making videos about all health education and sign language. So because of my podcast, more and more people are becoming aware about the lack of equal access in the deaf and hard of hearing community. I already have received opportunities from numerous down schools, local down organizations to provide education how to communicate with the deaf and hard of hearing community. Not only from the down school, I also receive email from the deaf school and some university to create sign language video to provide oral health education. So by sharing my experience, I was able to raise awareness around the school and outside my community. When I first started down school, not all the faculty and the down student know how to interact with the deaf student. They don't know how to provide accommodation. So I had to advocate for myself to express what I need and what's the best for me. That raising awareness leads to a greater understanding from the people around me. And also do the podcast by showing who I am. Also to show change the sound of the stereotype from other people. Most people think that the deafness is the disability, that we're limited, that we can't do anything. Growing up, being deaf, many people think that I can't succeed or do anything in the future. So showing myself in the podcast will help inspire the other deaf people to feel that, oh, I did it, and they know that they feel inspired that they can do it themselves too. Through the podcast, I was able to educate other people, healthcare providers around me, to they know how to communicate with a deaf individual. And the podcast also leads to change the influence of policy to help increase inclusion and accessibility in the healthcare setting.
Thank you. Dr. Singh, do you have anything to add to that?
Yeah, I think it was November 2019, if I'm not wrong, when I was interviewed as the first international guest at the Docs with the Disabilities podcast. And I remember exactly 1 year later, I got a panic call from, a very small town in the west of India, in a place called Gujarat. And the father said that, his young 17-year-old daughter had just got into medical school. And he was, very skeptical that, because in India, students join medical school quite early, unlike in the US at a very tender age of 17 or 18. And there was no one in their family who was into health profession or medical education. But more importantly, the father had a question that how, with Stargardt's disease, a visual impairment condition, she can thrive in a very cutthroat competition in the field of medicine. And that time, it immediately came to my mind the Docs with Disability podcast, where the amazing Dr. Lisa Meeks, she once interviewed Dr. Rita Knox, who is a psychiatrist at Mass General, and she had the same condition, Stargardt's disease. And I shared the transcript of the entire interview with the father, and that motivated the daughter also. That across the continents there is someone in as high as Harvard Medical School thriving professionally with that condition. I think it's a very big thing for someone who had no family background in the field of medicine and they have vivid dreams, but they don't know where the mentors are. And what it did was that it also galvanized me to, because I'm the co-founder of the Doctors with Disabilities, Agents of Change group in India. We started a subgroup on health professionals with visual disabilities. And later on, we came across another case where there was a medical doctor who acquired blindness later on, but he wanted to become a psychiatrist. And he cracked the postgraduate entrance examination also, but the medical board rejected him that since you are a blind person, how can you become a psychiatrist? So he filed a lawsuit, as Dr. Bonnie Swinner said, that when there is no data, and in India we don't have any data on the number of doctors with disabilities. So he had to file a case in Bombay High Court. He lost there. He filed it in the highest Supreme Court of India. And the Supreme Court said that no, we are interested in knowing that are there examples of Indian doctors with visual disabilities in psychiatry? And we provided that evidence as well as the evidence from the West. And right now, that person is a final year postgraduate training in psychiatry. And that's a living example of how one has to fight for their rights. They have to snatch their rights because when there is no reasonable accommodations and no support structure evident, they have to go to the courts. But gradually, I mean, hearing these stories from the Docs with Disability podcast, also this year we had the emergence of the first India's visually impaired woman doctor in India. And I often reflect back and I think that, whether Dr. Lisa Meeks realized the impact of that one interview with Dr. Rita Knox that particular day, because as that conversation traversed continents, weaving the tales of resilience, I'm pretty sure that, what it does is that it inspires the people. Inspire is not exactly the right word, but what it does is that it gives confidence to the people. From these are the stories from the global now, but these are being listened in as high as global south as well, and that's how people learn and they can find support where when there are none around themselves. That there are people, and with reasonable accommodations we can dismantle barriers and people can thrive and flourish their dreams. And by these initiatives like this great conference, the AIM, which happened earlier, what we are doing is that we are making this world a better place to live.
Did anybody else want to chime in on that question? All right, let's go on to the next one. So the next question is about lessons learned and shared. And this one is for you, Dr. Singh. So reflecting on the conversations, what is one key lesson or insight about navigating healthcare education or practice that you hope listeners remember and apply in their professional lives or advocacy efforts?
So once again, I keep on listening to the Docs with Disability podcast whenever I'm driving to my medical school. And I remember there was an interview again where one of the interview, they didn't have apparent disability, but they attended, yes, of course, your SMEDI conference a few years ago. And they shared the experience with their family that, how incredible it was that there were health professionals with disabilities and they were sharing their own lived experiences. And she was, very happy to listen to these stories, which are routinely not there in the medical conferences. And across the corner was her daughter. And she said that why would you relate that much to, these people when you don't have an apparent disability? And that prompted me to reflect back on my journey that when I joined a New Delhi institution as for the faculty position, I was looking for role models with disabilities and there were none around. Even those who were there, they dissociated themselves with their what I call as disability identity. So I think one of the very important thing is acceptance. And when I accepted my disability, I started this community of agents of change, talks with disabilities in India. Gradually, students, faculty members, and other health professionals, joined our movement. Now they're part of this community. So I think the first thing is, which is very important, is acceptance. And with that, what we realized was that, the struggles of people with other disabilities, because I have, mobility impairment, the experiences, the lived experiences of people with visual impairment are different than those with who are neurodivergent, are entirely different. But we need to support and learn from each other. But gradually, when I interacted more with other communities as part of my advocacy, I realized that, even there is a historical marginalization as far as the experiences are concerned, also with people who belong to the transgender intersex community. And that's how I learned that, there is a lot to learn from these parallel movements like, Black Lives Matter, Indigenous rights, fat liberation, queer and trans liberation, and environmental justice, reproductive justice, feministic movements. I think we need to learn from their share of barriers which they encounter and how they navigate those barriers. And very often, there was this wonderful series on docs with disabilities on the BIPOC series, and that brings out very beautifully the second idea which I would like to highlight apart from acceptance is that of intersectionality. So I think the two lessons which I learned from my journey as well as listening to the Docs with Disability podcast is number one, acceptance, and number two is intersectionality, and then of course the cross movement solidarity, because the struggles are same, and together we can all achieve this thing when we have respect for other people's, when they respect their autonomy, and we work together with them. Only then we can bring change and make this change place even a more beautiful world to be.
Yes, and you mentioned those are two of the principles of disability justice, right? So cross disability organizing and cross movement solidarity. Those are absolutely key. Dr. J, do you have anything to add?
Yeah, definitely. I mean, like I they definitely echo everything that Dr. Singh just stated. And one thing that I would like to add is like from like a medical trainee standpoint or from a resident standpoint is that as a person with a disability, we're still trying to go through this like rigorous training to like be the best kind of like doctors or healthcare professional that we can, and we cannot do that without getting proper feedback from our colleagues and then also our preceptors as well too. And I have noticed that a lot of times people don't always know how to give you feedback because they might not feel comfortable in how to navigate your disability in the context of your performance. So, I know that with me, like there have been like times like where I have like visibly struggled and felt that that I was like given like um generic feedback and didn't really feel like it was kind of helping me grow as a physician or as a doctor, or that I wasn't like really getting the good education or training that I wanted to be because the feedback wasn't tailored to myself. So I say that to like kind of like to talk to myself as well, and just kind of remember the fact that when it does come to getting feedback, I do have to be proactive in creating a space where I am advocating for myself and trying to discuss more about my disability and how that interacts with my performance, not in a way that tries to quote unquote like to like I mean just to kind of like have that as an added context for what's going on, and then by doing so I can also help tailor that feedback to myself to like kind of help me grow in the way that I need to let grow. So just ensuring that I'm sharing what I'm working on, I'm sharing what I'm struggling with, also sharing how I think I'm doing, and then also asking for tailored feedback on how to improve in the within the context of myself. And I think that with doing that though, I think it's very, very important that as medical trainees, that we still find time to engage in therapy. And I'm saying that as a person who just re-engaged in speech therapy like three weeks ago, you know, for the first time as a resident, like due to not having enough time in like in a sense. But I think it's just a reminder that, you know, in order to like be the best versions of ourselves, being in therapy, having our com community that like really supports us, you know, in this context of navigating this world that is already rigorous, is so important. I think it can kind of help us be the best version of ourselves.
Yeah, feedback like they're doing so great despite their disability is not helpful. I've heard that before, and I'm like, I don't want to hear that I'm doing great despite. I want to just compare myself to other radiology residents on the same footing. So my last question is for Dr. Kessler, and it's about the role of education in change. And so considering your experience, how do you see it contributing to a more inclusive and understanding healthcare environment for both professionals and patients with disabilities? And what changes do you hope to see in the near future as a result of increased awareness and education?
So as I said, when I decided to share my story, I had to go and really dive into the literature because I wanted to make sure that, you know, the things and the concepts that I was talking about were correct, right? I am sharing my own personal experience, but I'm tying them to the larger issues in healthcare and in our society in general. And through that, I've started doing a lot more lectures to medical students, grand rounds, to practicing physicians, to try to bring awareness to the healthcare inequalities that exist and to try to get allies outside of the disabled community to understand that it isn't the disability that's causing the problem, that there are other things going on, and that each and every one of them that I'm talking to needs to be an ally if they care about their patients and they take their, again, I'm talking mostly to physicians, their Hippocratic oath seriously, where they say that they're going to treat all people equally, regardless of their demographics. And so through sharing my story and Docs with Disabilities, I think it's given me that platform to be able to educate others and really try to get allies to help with the change. Because until healthcare as a whole and not just the disabled community recognizes that it's a problem with the providers and not necessarily with the individual's disability, we're not going to have bigger systemic change, right? We need the allies to be able to do that. And we need healthcare providers as a whole and really society as a whole to understand so that we can make policies and procedures and have people speak up. And in the lectures that I give, I get a lot of people asking, well, I see these inequalities all the time, but what am I supposed to do about it? I'm just one person. And that's where I say, okay, go to the manager of the floor. If you can't provide the care for that patient adequately, why? Ask yourself why. Are you missing a wheelchair accessible scale? Then that needs to be in the budget for next year. So you need to go to the person who is buying the supplies for either that clinic or that hospital and say, we need to budget this. That's a commitment we need to make. And that's part of where I think education and change is a lot of people, when they first notice that there's a problem, sometimes feel helpless and don't know what to do about it. Like, I'm just one cog in this larger wheel. And what I think through education is that we can empower people to say that one person can make a difference. And advocacy doesn't have to be at a national level. Now, oh my gosh, we need people advocating on a national level. So don't get me wrong, we need those people too, because we need them to be helping with the policies and the laws and things. But people can also advocate in their own clinic, in their own hospital, in their own medical schools to be those drivers for change. And it can't just come from the disabled community, it has to come from everybody. And so I think that's where the education piece for me has become so powerful, to empower people who maybe didn't know what to do in the past when they saw these inequalities, that their voice can help. And even something as, quote, simple as saying, we need to do better in our clinic. We need to have interpreters. We need to have more staffing. We need to have a call light that you don't have to push your finger to get nursing help, right? These are all things that can and should be there. And we need people to be able to speak up. But if they aren't educated on even what to ask for, they don't feel like they know what to do. And so that's where that education piece, I think, can really help with the broader community.
Where can people find natural allies? Where have you found yours?
I found allies all over the place. I mean, this is where I said I truly think that physicians and other healthcare workers, they want to do right by their patients. They don't always realize what they're doing that maybe is helping to contribute to this ableism and to these healthcare inequalities. And I think it does take people educating themselves. There's lots of websites nationally. Even I start with ADA. There's some really great just examples of what people can do. There's obviously literature from your group all over on the internet that people can look at. There's data on universal design if you're designing a new clinic or area. So there's so many places where this information is available, but people have to go and look for it.
Yeah, I've found that going to the diversity community in particular has been really helpful. And those in the diversity space are natural allies. And I think that's like a really good place to start. If people are thinking about maybe starting a group at their own institution, or you know, even starting their own advocacy organization, that the first place they should go is to their diversity leaders.
So yeah, actually that's at our medical school. There were some medical students who started DACMed, so Disability Advocacy
Mhm.
Coalition. And they specifically said this is a group for students with disabilities and allies. And it's the first time, at my institution where I saw that they said, we're really trying to pull in everybody. And that's what they did. They did end up getting put, I'm one of their two faculty mentors with Dr. Leslie Rydberg, but they are housed under the DEI umbrella. And so they do have support from our DEI office as well. So you're right. They are a great resource too.
Dr. Simona, do you have anything to add to that?
Yeah. I do agree with her that the issue, the lack of education, awareness, and the disability. When I first started school, I did the only deaf student in my whole school. Many of the faculty, the Down students, have no idea how to communicate with the deaf person because they never experienced one. So, throughout my education, I had to advocate for my needs and to educate the faculty. For an example, one of the faculty members came up to me. She never worked with me before. So she asked me if I can learn do I know how you read or write? So in that way it's a little offensive, but I have to educate her what the definition really is. How I have to try to educate all the faculty to provide a more an inclusive environment. So I do think that advocating for my needs, showing my thought, sharing my experience, help increase awareness to lead to more inclusive environment. So that's why during down school, when I did a podcast and when I created my own sign language video for all health education, So I did a part of my research project and I posted on YouTube. And when I got like 10,000 views, the more and more people are becoming more aware of my disability and how it's important to advocate for equality in the field. So one Hispanic dental organization in Seattle, Washington reached out to me. They wanted me to give a presentation sharing my experience and how to educate people that are deaf and hard of hearing. So I was there. After that presentation, many more other dental students from different dental schools have reached out to me because they want me to provide more of an inclusive training program for their school, how to treat deaf and hard of hearing patients. So I do think that sharing my experience giving lecture nationally will help in lead to more inclusive environment. It's still very early. I think it still need to be a lot more work. It can't just come from me. I also need support from other local dental organizations. That's why I started locally. Once I become increasing awareness of the disability in the dental field, that way the word of the mouth can slowly increase to more of a higher level. So I hope in the future, sharing my experience will reach out to other schools to include more of a comprehensive training program how to treat people with disability.
Yeah, and I think these training programs should be mandatory, just like other trainings we have to do around sexual harassment um, and other mandatory trainings. So, I mean, the one theme that I picked up from all of your interviews, like I said, is the importance of mentorship. And all it takes is one story. Like you said, for Allison, Susie Kim, Dr. Singh, for that person who called you in West India. You were that one person who gave a ray of hope. So I hope that's what everybody takes away from this episode of the podcast is the importance of being open to being out, to sharing your story. And I think that's just so important. So we are at time. I'd like to thank you all very much for your insights on this episode of the Docs with Disabilities podcast. It was wonderful to see you and speak with you.